today we're going to talk about how you should appropriately transfer somebody with a Hoyer. So we've got Julie here, she's our patient, she's bedbound, and we're going to be using a Hoyer sling. The first things that you want to look at when you are doing a transfer is that the Hoyer sling is clean and dry. You want to make sure that you're using the appropriate size for the patient. All of the Hoyer slings are color-coded. You'll see different color stripping on them. There is a legend in the room where you get, in the laundry room where you get these. But there's also on the top, this one's on the bottom. On the bottom corner, they all have a label that is ironed on. This one says medium. So you can see that. So you can appropriately make sure the right type of sling is used. When you use a Hoyer sling, you want to have the commode opening down here. Obviously the straps come on the outside. You're going to have the patient assist to roll. And you're going to tuck that Hoyer sling and the strapping underneath with the commode opening being right at the bottom. Okay, Julie, do you want to roll back?
Roll back.
There you go.
And all the way over. Okay. Kind of check to see if she's in alignment here in the center.
I'm going to scooch over just a little. There we go.
Okay.
The reason that it's very important is because you want the Hoyer sling to reach right underneath the knees, all the way up to just at the base of the head here. If this sizing does not look appropriate and your sling goes too far down or too far up, you're going to find that the patient could slide through the commode opening, or you might have trouble once they sit in the chair. So it's very important to make sure you have the right size. If there's none in the laundry rooms, you can call down to Chris and Ann. They have an extra area where they can get some more slings if there's none in laundry. Anything to add?
Nope, just need to approach with a Hoyer.
All right. So when you're doing the Hoyer, anytime the patient is in the Hoyer and you're moving it, these legs should be open to provide the best stability so the patient cannot tip. You should not be moving the patient over open areas with the legs together. That's very dangerous and that's a hazard. So I'm going to narrow it up to come under the bed. Make sure that you don't hit any electrical cords underneath. You'll notice we did have the bed raised a little bit while we were rolling. If you did have the bed high, you can always lower it down at this time, as long as it's not going to get stuck on the Hoyer. So you just want to keep an eye on that and make sure that it's not going to stick. I'm going to move the chair over here too, so we get a little closer. I'm getting the chair prepared, and the brakes are now locked on the chair so it doesn't move. The foot pedals are off of this chair so that they don't get in the way. However, if a patient has a footboard on there, you may find that you need to come at it at an angle. And sometimes I'll even put the Hoyer around this way. So you'll just have, if you have troubles, you can always ask therapy. So now we're going to do the most important part, and that's hooking the patient up. So you want to make sure it's down low enough so that they can reach. And we'll start on the bottom with blue. Green grass. Oh, sorry. Green grass. Make sure that you get the green, and then you want to double strap that. So it's not just the green strap, you're going to have this secondary black strap on as well. And then the blue at the top, double strapped also. If we want you, if the therapy department wants you to use any different strapping than these colors, green on the bottom and blue on the top, we'll put it in the care guide. So now what I have the patient do is cross their arms over their body, and then Julie is going to guide the patient while I'm working the machine. But I'm going to give it just a little up here to make sure that all of these straps are taut and that there's no room for them to move. Once I know that they're fully secured and on, then we'll go ahead and continue the transfer. Any more you want to add? Okay. So we'll come all the way up. You want to make sure that the patient's bottom is fully up from the bottom of the bed so you don't have any shearing as you cross. So we're clear from the bottom of the bed. Now I'm going to come out. Open the legs just a little.
Relax your legs too.
Okay.
There you go. Yep.
If a patient has trouble with their legs, you can always have somebody help guide those, but you want to be careful that you don't bump them here. So I'm just getting this out far enough from the bed, and then I'm going to widen that base again, like I told you earlier, to make sure as we turn, we're in a safe distance here. So as far as positioning them over the chair, you want to get them back. The person that's helping is going to have their hands on the strap, and then the person that's running the front is going to very gently apply a little bit of pressure as we go down to make sure that the patient's hips are seated all the way in the back. As you come down, let it go forward a little bit so that they don't get knocked in the nose with that. Come all the way down, release the strapping. It works best if each person takes a side, because then that way you know you're holding on to it and it doesn't come back and hit the person in the nose. You'll move the Hoyer out of the way. You'll unlock the chair, back them up, put the leg rests on. If for some reason they get into this chair and this Hoyer sling has slid, or let's say they've been in the chair and you've had to use it to prop it up. Okay, I'm gonna have you just stand up for 1 second. There you go, now sit on it. Sometimes we find the Hoyer slings are like this.
Yep.
If you find a sling that is not appropriately down behind the backs of the legs, you want to make sure that you either contact a nurse, a therapist, another aide, so that you can get this figured out, because you do not want to transfer them like this. This is unsafe. They would be at risk for falling out. So what you can do is you can have them lift up and you can see if you can pull it forward just a little bit, but make sure that you kind of watch that leg. Now, if it's not coming all the way down, if you can't get it all the way down, you can have them lean forward and tuck a little bit of that sling that might have slid up down, so that then as you do that and you pull, you get a little bit more because it's not stuck. So this would be appropriate for her to be transferred back out, because this sling is all the way down behind her knees.
And then just
Yep. And then when you're done, you want to tuck these up out of the way so they don't get caught into the chair. And that would be it.
very good.
All right, thank you.